Okay, what brings you in today?
Well, I would like to discuss I have some furrows and wrinkles, and my face seemed to be very long and droopy, and I have some jowls. And I was wondering, is there anything I can do for that?
Yes, there are things you can do for that. So there are surgical treatments, surgery, to address many of the issues and concerns that you had. And then there are non-surgical treatments to address a lot of the things you talked about. So let's talk about the non-surgical treatments. So there's a number of things that you addressed on your face that concern you. One was wrinkles that you said. And wrinkles are caused by a number of different things. One thing would be gravity. So as your face falls, you develop wrinkles. That's normal, everybody gets these. But it causes a lot of the wrinkles that you see around your jawline, the folds that are around your mouth, and some of the folds around your eyes. Another thing that causes wrinkles is the sun. So sun exposure will cause wrinkles, especially when we squint a lot. And fine lines around the mouth and around the face are often caused by sun exposure. And then the third thing that causes wrinkles is your muscles of your face moving. So as you raise your forehead, as you scrunch your eyes, as you squint, those muscles move and they create lines, and those lines over time, over all the muscles moving repetitively over time, present as wrinkles. So you see these as lines or wrinkles on your face. So one of the ways of addressing first the lines that you get because your muscles are moving is with a neurotoxin like Botox or Dysport. Those are the two most common injectables we have. And what these do is these are injected into the muscles that are moving, such as the muscles that move that bring your eyebrows closer, or the muscles that raise your eyebrows or squint your eyes. And these are injected into those muscles, and it paralyzes the muscles, which means that you can't move them anymore, so you can't move and create those lines. But you don't want to completely paralyze these muscles, because then you look frozen with very little expression, and I believe it's important to look natural and to have expression and be able to, without creating these unwanted lines. And there is a good balance to that, and that really is the art of Botox. So now we have to talk about the other issue that you addressed, which was the loss of volume, so the drooping of the face, and some of the lines and wrinkles that develop around the mouth area. And what we have to address those are fillers. So these are things that add volume to your face. And we have a number of different products that we can use to fill those areas. One product would be Juvederm or Restylane, which are hyaluronic acid fillers. We also have Radiesse, which is another type of filler, and Fat would be another example of a filler that we can use. And these fillers are injected into areas such as the cheek, or the lines around the mouth, or the areas around the jowl, to add the volume and to reduce the lines that you see. So that's one modality in order to fix that part of your concern. And oftentimes these two work really well together. You use Botox to stop the lines, you use a filler to add the volume. And then we need to talk about the third treatment, which would be laser treatments to the face. And one of the best laser treatments that we like is Fraxel treatment. And what that does is it helps treat the skin in particular. So if you have a lot of discoloration, sunspots, melasma, which is a hormonal discoloration, as well as the fine lines, because we haven't really addressed those fine lines around the mouth or around the eyes. Fraxel is great for that. It really smooths out the skin tone and helps eliminate some of the fine lines that we're talking about. And as well as the age spots and the discoloration that we see. So all of that is smoothed out with the Fraxel treatment. And then we also have a treatment called Ulthera, which is an ultrasound treatment that helps tighten the skin as well. So when you take all of these treatments together, depending on your concerns and what really bothers you, we can mix and match a lot of these treatments to give you the best non-invasive way of treating your skin and your concerns.